Hey guys, welcome to Desk Jockey Physio, where we help active desk folks feel and move better. My name is Mitch Starkman. I'm an FCAMP registered physiotherapist and sports medicine clinic owner here in Toronto. Thanks for stopping by. Hey everyone, welcome to part 2 of our snapping elbow video. So we actually put this video out maybe a year and a half ago, and we've had a ton of views, ton of questions, so we thought we'd add a little bit more into it. A lot of the questions have revolved around the anatomy of what's actually going on. So today we're going to review that. We've also created a phased program for this to kind of take people from start to finish, because we get a lot of questions. We have some basics that you can try in the first video here. But if you need a little bit more, you can also check that out. We also offer online one-to-one programming as well, which you can check out at deskjockeyphysio.com/online. But we'll put a link to everything below as well. So let's get started. Now, with snapping elbow, there's two structures that could potentially be involved. The first and most common is something called your ulnar nerve. That's a nerve that runs from these two fingers here, your ring and your baby finger, up the inside of the forearm to here, underneath the armpit, through the chest, into the neck. So actually the nerve runs all the way down. It's more commonly known as your funny bone. People bump or hit their elbow in this space here. They can it becomes a little bit exposed or superficial in certain areas. And if you hit it, boom, it lights up the whole thing, and it's not so fun. We've all done it, right? So that's the most common. The second most common one that it can happen is actually not the nerve, but the muscle. So your tricep, which is made up of 3 heads or 3 bands that run up the back side of your arm, the one on the inside can actually attach a little bit shallowly or tighten up to a point that when you bend and straighten, it flips over top of the bone. That can happen as well. So both of these two are options. In the program we've created, we actually tackle both of them. Depending on which one they are, you can treat them. Now, at a certain point, some people's anatomy is at a certain limit that surgery is necessary. Not always, but sometimes you got to see a healthcare professional and learn about that from them. But I'm going to talk about the basics today. So just to give an example, if I take this nerve and attach it here, right, and then I bring it up behind my back and anchor it, and just to give you an idea of kind of where this nerve runs, is running up the inside of my hand here. And as I bend and straighten, you can see that if it's not held, if I don't hold that in place here, what can happen is it can snap, right? I can come up and it will snap over top and snap. So if I want to fix this issue, what I need to do is stretch the nerve. Now, nerves don't like to be stretched. Their flexibility increases maybe 15%. So instead what we need to do is increase the flexibility of the muscles that surround the nerve to free it up. And that's a big distinction. You don't want to hold the nerve in a stretch position because it'll get irritated and pissed off at you and it won't feel comfortable. So instead, what we're going to do is loosen up the muscles of the forearm, of the triceps, strengthen certain muscles that will turn off or disengage some of these muscles that are tighter, and most importantly, change how you move. So again, this is the snap that's happening. The same is true of the tricep tendon. It would just come up to here and it would snap over top of this bone. Now you can imagine if you snap that over and over, you will get pain and discomfort, and we don't want that. So if you are doing things like shoulder presses, push-ups, and it's snapping or clicking, do your best to modify or change your position to get rid of it. Change your hand position where your elbows are moving, or in day-to-day, the same idea. If you can't modify it, you might want to look at doing a different exercise to strengthen that area. It's another really common question that we get. So all that to say, this can either be a tricep issue or a nerve issue. It is often treatable with exercise. We've created a program to hopefully help you with that. We also offer one-on-one therapy online if you need that as well. And in the event that it's not getting better or you're really having issues with it, it's always a good idea to check in with your local physical therapist or family doctor or sports physician. I hope that helps. This is our big update on this topic. And if you do like this, please head down there and hit the like button. You can subscribe, share it. We really appreciate that. And most importantly, move like you mean it. Thanks a lot.